Well, it's time to get your medical questions answered. Dr. Zorba Paster is taking your calls at 270-9933.
But first, a new study suggests omega-3 fatty acid may help offer protection against type 1 diabetes. Our doctor on call, Zorba Paster, joins us from his clinic in Oregon with
Zorba.
those details. Hi, Zorba.
Hi. Great to be here.
So what's the
By
study?
the way, I want that bed for me, by the way. That's what I want.
Move over.
So let's talk about omega-3. What's so good about it?
Well, what's interesting is omega-3 fatty acids, and we're talking about whether or not you supplement or not, might help reduce type 2 diabetes. But there have been a lot of issues in and out of this because fish oil is filled with omega-3 fatty acids. So the upside is it may be useful, but the downside really is, can you get this out of a capsule? And I have been against the capsules for years now because the data really shows the capsules don't do much, but the food that has omega-3 fatty acids is very good for us. So nuts, all different kinds of nuts. Peanuts do not have as many omega-3s. Cashews, pistachios, walnuts have omega-3 fatty acids, and of course fish. And we know that people who eat fish once or twice a week are just healthier, reduction of heart attacks, strokes, and perhaps diabetes. So I'm all for omega-3s, but if you're going to get it through food. Mother Nature knows best.
I'm having catfish tonight. So there you have it. All right, let's go to the phones. We'll start with Karen from WIOTA. Hi, Karen.
Hi.
What's your question?
Yes, Dr. Pastor, I have a question in regards to the shingles. I know you've talked about these before, but I had the shingle shots 5 years ago. Now, will this protect me for life? Do I have to have a booster shot? I understand that if I would get the shingles, it would not be as bad, correct?
Right. The answer is we don't, at this time, there's no recommendation to get a booster shot, so we only give it once, sort of one and done. The problem is the shingles vaccine is not 100%. It's really only about 50 or 60% when you're 65 years of age, and when you're older, the immunity it gives is even less. But if you do get shingles and you've had the shot, the chances are it won't be as bad, and the chances are also that you won't get post-traumatic neuralgia, which is really this devastating, long-acting pain that can happen after shingles. So I'm very pro-shingle shots. I think it's really important. Is it 100%? No, but it helps to get it.
And if your immune system is compromised, you probably shouldn't get the shot, right?
Well, you have to, there are certain things. If your immune system is compromised, you should not get it. And then there's certain other things. And when you get your shot, one of the things the doctor or the pharmacist, because they both give shingle shots, they go through a series of things that determines whether you're eligible or not eligible. Okay. There's a whole checklist that we always give for any immunization, by the way.
Okay, our next caller, Anna from Footville. Hi, Anna.
Hi. Dr. Paster, I'm just wondering what you think of the new pain pump that UW is using for chronic pain people.
Well, you mean the pain pump that you would have, where you would have an
that
opioid that would actually be delivered?
And then the pain is, the medicine is distributed as it should be.
Sure. Well, there are a couple of different kinds of pain pumps. Some are the pain pump that I think you're talking about is one that is often delivered by a catheter into the back, into the area where a person has chronic intractable pain that is just cannot be treated with oral pain medications. And those pumps, when used effectively, can be very, very good. The problem is the selection of the right person for the pump. Sometimes it's not exactly a straightforward thing. But I think they're very good doctors at the UW. They know what they're doing for people with intractable pain. I certainly think it's an option. You know, intractable pain is awful, and opioids, we know, do not get rid of pain in some people, and so the pump is often the way to go.
And a lot safer, too. Mike from Madison, what's your question?
Yes, yes, doctor. My name's Mike Shepard. I'm going into the hospital next week to have a cancer removed, and I'm supposed to go on a liquid diet. What is a liquid diet?
Well, they'll define exactly what they're doing. What kind of a cancer do you have,
sorry,
if
he's
I
gone.
may ask? Okay. Well, there are different kinds of liquid diets. Some are full liquids, some are liquids that are clear liquids. It all depends on the surgery. And usually, if you go on a liquid diet, that means you're doing something with your guts. It's usually a cancer of the gut. And the liquid diet is to clear the guts so that it's easier and safer to do the cancer surgery.
Our next caller, Sandy from Stoughton. Sandy, what's your question?
What I want to know is, does glucosamine with MSM help your joints? And does CoQ10 really help you not have a heart attack?
Well, first we'll do the CoQ10. The jury is out on CoQ10. Some studies seem to show it may help. A lot of studies show that it really doesn't do very much good at all. We know getting control of your blood pressure, getting control of cholesterol with Lipitor and other drugs like that, we know really helps, as well as diet and exercise and so on. Now, as for whether or not glucosamine, either with or without the MSM that you mentioned at all, will work, the studies have been very disappointing. There's some people who say, really, it works for them, and I tell people if it works for you, it doesn't harm you, and it's not too expensive, keep on taking it. But the double-blind, placebo-controlled studies have not shown it's useful. Even though the earlier studies pointed it out, the later studies simply did not show that data.
All right, let's go to Shannon from Janesville. Hi, Shannon.
Hi.
What's your question?
I got diagnosed with influenza B, and it's been probably about a good week. Do you know when I should get back to feeling better?
Yes.
Or what could help?
Yes. The answer is yes. That's about what I'll say. Influenza B can take 3 weeks, easily can take 3 weeks. So you may feel good and you may feel bad on and off for the next 3 weeks. Stay hydrated. Take over-the-counter Robitussin DM. The generic will work out very well for your cough. Do not ask your doctor for a cough syrup because the cough can be quite disruptive, but it takes a while. And if you didn't get your flu shot this year, make sure you get your flu shot next year and for the rest of your life.
3 weeks, did you say?
Can take 3 weeks, absolutely. Let's not forget that influenza A and influenza B actually kills often about 10,000 people a year. It's a lot of people. It's a disastrous virus if you get it, and it can last for a long time.
Another reason to get a flu shot.
Absolutely.
Rest.
Thanks for everyone for calling in. Thanks for everyone for calling in. We are out of time. We'll do this again very soon. Zorba, thank you for your time.
Thanks. Great being here.